Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hello, good morning. It's Gil Lederman. I'm here live in the WOR studio. I hope we all are live today and in good health. We have lots to talk about, lots of new cases and new news and new other things. You're welcome to call. Sometimes people say, well, why didn't you explain this? A patient came in this week and said, why don't you explain what Gleason score is and PSA is? And I said, wow, I thought I explained it so much that you'd be bored of that. He said, no, I never heard you explain it. So that's why you're lucky you can call in. And the number is 1-800-321-0710. 1-800-321-0710. We're happy to hear from you and answer your questions. That's what the show's about, a dialogue, explaining things, explaining cases, work we do, understand how doctors think, understand the data or lack of data, understand when someone says something, oh, it's so fantastic. Is it? Or is it all baloney? So that's what we're here to explore, and we're trying to get you the data and trying to get you facts and trying to get you things that you can trust. So when you make healthcare decisions, or if not today or if not tomorrow, maybe 5 years from now or 10 years from now, you can learn the questions to ask and how to get better care. So some people say, what is radiosurgery? We know, Dr. Lederman, you developed this technique in America. You brought it here. You were the first ones here. But what is it? What is it? So I'm going to talk about a case, and this is a man I saw this week. And by explaining the case, I think you can understand what we do. So this was a man. He is a man. He's working, 56 years old. He came in with his girlfriend and his daughter for consultation. He had metastatic colon cancer. Now, in 2006, he first saw his doctor. At that time, he had 4 years of rectal bleeding. And for 4 years, he was told it's nothing. And no one ever looked. Can you believe that? For 4 years, he was told it's hemorrhoids. No one looked. And then in 2006, he came in for colonoscopy, and they were unable to do colonoscopy because the cancer had obstructed his colon. So the idea of hemorrhoids was all baloney. And he suffered for 4 years unnecessarily with bleeding and pain and discomfort. He saw his doctor, and no one would listen to him. Wow. Finally, he had a resection of that colon 4 years after the bleeding started. And by that time, the cancer had traveled to the liver. So instead of a localized cancer, it was a stage 4 cancer. Started chemotherapy. They put in a hepatic artery pump, a pump to give chemo to the liver. Well, the pump relocated, let's say, gave its chemo to the duodenum, bled the duodenum, and the patient had multiple surgeries to repair that. So he had a misdiagnosis, a 4-year delay, a pump that went awry, complications, ended up with super infections in the hospital. That's what we talk about. Hospitals are great, especially if you can stay out of them. I mean, so many people get infections, and they get super infections because so many patients are on multiple antibiotics. And the more antibiotics you're on, the more it teaches the bacteria to be super resistant, which is exactly what you don't want to have happen. He was hospitalized for months with a super infection, super complication from a super procedure that went awry. Wow. He had recurrence of his cancer in 2012, and the surgeons went in there and removed it. 2013, he had another metastasis, and then another metastasis. You can imagine, after 7 years of all this medical, let's say, care, he heard about us, Radiosurgery New York, Dr. Lederman. He came in for a consultation on January 21st with his girlfriend, with his daughter. We reviewed his case. We got him staged up. He had 3 spots of cancer, 1 in the groin, 2 in the iliac fossa, which is the part of the pelvis by the hip bone. So when you put your hands on your hip, well, in his case, if you put his hands on his hip, deep inside would have been 2 metastases and a 3rd in the groin. He was fed up with all the other stuff, chemo, surgery, standard stuff. Came for radiosurgery. We were able to treat those 2 lesions in by the hip bone simultaneously. So we got 2 for 1. And then we treated the 3rd lesion separately. Radiosurgery means no surgery, no cutting, no bleeding, no hospital stay. We're a private outpatient center. There's no super bacteria. There's no ICU. There's no miles of corridors with locked doors and strange faces and people looking at you. No. A private center means it's there for you. You're the boss, not the drug company, not the president of the hospital making $3 million a year. We're there for you. So he trusted what we said. We went ahead and gave him 5 treatments to those 2 metastases in the pelvis, 5 to the groin. He was on another radio station. We have another radio show Saturday morning on WABC from 5 to 6. And he called in and he said, "Doc, you left out most of the complications." I said, "Well, yeah, because I don't know if people believe you had so many complications, such a long story." He said, "Yeah, it's all true." And I said, "Well, what's it like?" And he said, "Well, he takes a train in. We're very close to Penn Station. We're very close to Grand Central Station. We're in the epicenter of New York City. He comes in, gets a treatment. It lasts 15 minutes. He lays down. The beam moves around the cancer. He doesn't feel anything. There's no cutting, no bleeding, no injections, no anesthesia. He gets up and goes home. Well, he had his treatments for these 3 metastases. He came in this week with his new PET scan. And how do we know the cancer is working? Well, cancer treatment's working. Well, we get our report card. The patient gets our report card, and he or she knows what's happening. We don't hide things. And that's what's shocking. So many patients come to see us, and they have no reports. They have no pathology, no PET scan. They were given nothing. This man was given 3 copies of his CDs. He can go home and look at everything. He was given a copy of his report. Everything is in remission. All the PET positivity is gone. Tumors are shrunken or gone. He's in complete remission. There's no new cancers. He's had no side effects. He's working as a heavy equipment operator. He told us on the radio yesterday, on a radio show at WABC from 5 to 6 yesterday, he told us he's planning to get married in August. Hey, isn't this what you want? Isn't this what you would want for yourself or your loved ones? A man who'd gone through so many delays, so many complications, so many super infections, to have treatments go as planned, as promised, with results that were superb. So he's happy. His girlfriend, fiance's happy. His daughter's happy. We're super happy. And this is what radiosurgery is about. So it's not just for colon cancer or not just for metastasis. We treat brain tumors. We treat primary cancers. Some people don't want to have primary treatment. They'd rather have radiosurgery when the cancer is first diagnosed. So what do? We sit down with the patient. 50 years ago, when I was a little boy in Iowa, I remember my grandfather would go to the doctor, and he'd tell me, well, he told the doctor, come on in, doc. Just close the door, sit down, and stay a while. And that's what we do with our patients. We follow my grandfather's advice. We close the door, we sit down, we stay a while, and we understand what's going on with the patient, what needs to be done, what we suggest, what are the options, and then you decide. You get to decide, and that's how it should be, because you are the president of the United States of your body, and we work for you. So if you like us, great. If you don't, we've tried our best, but this is the work we do. This is the work that we brought to America, stereotactic body radiosurgery, non-invasive treatment that allows us to treat cancers most anywhere in the body, from head to toe. And you name the site, and I can tell you that I've probably treated it many times. We've done about 20,000 patients over the years, and we follow our patients. We just had a new paper accepted at the largest national, international radiation cancer meeting. We just had a paper. Most big hospitals don't have papers accepted. Radiosurgery in New York, Dr. Lederman is presenting his paper on the treatment of radiosurgery for metastatic cancer this fall in San Francisco. So it's fantastic news that was led up by Dr. Ariel Lederman. And we will show you that data if you want. So if you have questions about cancer treatment, it's worth a call. It's better to come in, sit down, stay a while yourself, and go over the facts of the case. We're going to hear from some new voices about our work and how to contact us. And we're happy to take your call if you wish. So you can call us at 1-800-321-0710. That's the WOR number. We're live in Manhattan, WOR, 1-800-321-0710. And we'll be back just after this word.
Cancer treatment most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the